The glimmer of hope in a mother's eye, the agony behind a child's cry, the essence of humanity in doctors' actions, the story behind nurses' compassion, the pain of leaving everything behind, the right to live with dignity denied. We see it all. This act of bearing witness, of willingness to speak about what we see, of being there when it happened, as it happened, it's what drives us at MSF Without Borders Media Fellowship. Bringing together journalists, photographers, and filmmakers to empower those who cannot speak for themselves, building public awareness around issues that are most often neglected by mainstream media, creating real-time impact with stories that spur action, mobilizing change across geographies and frontiers, covering stories with courage and heart on the mental health of refugees and children orphaned by the COVID-19 pandemic, underlining healthcare gaps for the vulnerable population, putting the spotlight on the need for better access to healthcare and mental health, bringing the voices of the vulnerable to the forefront, telling stories of those affected by neglected tropical diseases and drug-resistant tuberculosis, highlighting the need for accessibility to tests and long-term treatment, reporting the lack of mental health in remote areas, the repercussions of climate change on mental health and accessibility to healthcare. We tell the stories of those affected with clarity and credibility. The Without Borders Media Fellowship helps fearless reporters to bear witness and usher in hope and healing by going where the story is, by asking the right questions, not just covering suffering, but focusing on solutions. We give the crisis a face by building intent and mobilizing action, by inspiring commitment for tomorrow. Today, Without Borders.